So today we're going to talk about cellulitis, which in Uganda they call it talo. So here in Africa, like specifically Uganda, there are some people in the villages there who still think that cellulitis is some form of witchcraft. Like these people think like there is someone who dropped some stuff on their doors, like, and when they jump them, they get that form of cellulitis. And these people still think that cellulitis is typical witchcraft. You might find these people when they don't even go to hospital. Yet you have to go to hospital to get some treatment here. So in this short video of 5 minutes, we're going to talk about what are the causes of cellulitis, symptoms, and how to prevent it. So cellulitis is a common bacterial skin infection that affects the deeper layer of the skin and the tissues just beneath it here. So it causes the skin to become swollen, red, and painful here. So what do you think are the causes of cellulitis? So cellulitis is caused by bacteria. We have Staphylococcus aureus, Streptococcus pyogenes. So cellulitis is caused by bacteria entering the skin through a break in the skin, such as a cut, scrape, or insect bite. Common bacterial infections like those, when you get those cuts, scrapes, like those Staphylococcus, they enter through those cuts here, and then they cause cellulitis. So what exposes you to cellulitis? You know, you have known the causes. What exposes you to cellulitis? So here at first we can talk about skin injuries. When you have cuts, scrapes, burns, insect bites, those ones can increase your skin to getting cellulitis. So remember, they leave your skin open, and that Staphylococcus or the Streptococcus enters there, and you get that cellulitis. So we can also talk about weakened immune system. So people with weakened immune systems, such as those with HIV or diabetes, you're prone to getting cellulitis. So the third one, you can also talk about skin conditions, like people with eczema, or like those people are very common to getting what? Cellulitis. We can also talk about obesity, like obesity can increase the risk of cellulitis. So the last one, we can talk about lymphedema. So lymphedema is a condition that causes swelling in the arms, legs, and can also increase the risk to cellulitis. So what are the symptoms by which you can see that I have cellulitis and I should immediately go to what? To hospital, get treatment. So the first one is redness. Like the affected area of the skin is red, it becomes red, and often it becomes warm to touch. When you touch there, you feel like the skin is warm and like the skin is red. So that redness. So swelling, we can also talk about swelling of the skin. So this one, like you feel like the area is tender, the area feels firm and tender. So that's swelling. You can also, that's also a symptom of cellulitis. You can also talk about pain. Like that area is usually very painful. Where you have cellulitis. So we can also talk about warmth. Like when you touch that area is typically hot. You can touch the area and you feel like this area is very hot. So when you have cellulitis, that's one of the symptoms. We can also talk about fever, like those people who get cellulitis, most especially, like they get that kind of fever. So we talk about chills. So those ones may also occur. Blisters, like people like get some blisters on their skin. You can find that, you know a blister, like this one, which normally happens when you get a burn. So that raised skin surface. So that's superficial skin, raised surface of the skin. So that's what they call a blister. So what should we do to prevent this cellulitis? What can you do if you're in a village there to prevent cellulitis? First of all, keep your hands, keep your skin clean and dry. So you should keep your skin clean and dry if you want to prevent cellulitis. Secondly, wash any cuts or scrapes with soap and water. So if you get any cut, wash it with soap and water, and then apply an antibiotic ointment to that cut. So I can also talk about keeping your skin moisturized. So that thing is very important. So also avoid scratching or picking at your skin. So there's these people who like scratching themselves, like every time they are scratching themselves. So you should avoid it. So the last one, you should see a doctor for any cuts or scrapes that are very deep. So if you get a deep cut or scrape, you should immediately go and see a doctor so to avoid that cellulitis. So cellulitis, you can get treatment very well. So very many people have healed from cellulitis. So you can go to hospital. Like some people, in most cases, go to hospital when they think that they are bewitched, but unfortunately they come back when they are very well. Yeah. So it can be treated very well. You should not be scared. You should go to hospital and get treatments. So thank you very much. I remain Mujib.